My name is Robert Lechler. I have the privilege of being the president of the Academy of Medical Sciences that's organized today. By background, I'm a nephrologist and an immunologist, and my day job, I look after half of King's College London. So the Academy of Medical Sciences, let me introduce that to you briefly. The Academy's function and purpose is to promote biomedical and health research and foster its translation into patient benefit and population health gain. That is what the Academy exists for. And it's made up of its fellowship. So now there are just over 1,200 people who've been elected to the Fellowship of the Academy of Medical Science. It's highly competitive. We elect 48 fellows each year. There are about 380 people in the pool wishing to be elected. The fellows are distributed around the UK. Of course, so you can see a concentration in the southeast, but that reflects the concentration of academic medicine in the southeast. But we're very committed to covering the whole of the country, and indeed we do that. And there are regional champions distributed around the country that coordinate the activity of the fellows in a region. And we very much hope that most, if not all of you, will be aspiring to become fellows of the Academy in the future. So here, under the overall heading that I mentioned, are the 6 strategic objectives that the Academy seeks to deliver. The first is quite simply to promote excellence, and that's very much linked to the election of the brightest and best minds in academic medicine into the Fellowship of the Academy and promoting scientific discourse between them. Secondly, we seek to influence policy that will create a more conducive environment for biomedical and health research to flourish in the UK, and lots of work goes on in that regard, and we produce influential policy documents. Thirdly, and that's really what today is about, we seek to nurture the next generation of medical researchers, both clinician scientists such as yourselves, but also basic scientists. And I should have said that of the 1,200 fellows that I mentioned, about 50% are clinician scientists and 50% are basic non-clinical scientists. Fourth key function is to develop ever closer relationships between 3 sectors that are absolutely vital partners if we want to have the impact on medicine that we wish to have, namely the academic sector, universities, industry, pharma, biotech, medtech, digital tech, and so on, and the NHS. And so we have something called the Forum that brings these sectors together for discussions on topical subjects. Fifthly, we are not parochial in our thinking, we're international and global in our thinking, and of course that's never been more important, particularly following the referendum vote last year, that we reach out and make as many contacts and collaborations internationally as we possibly can. Europe, of course, in the context of Brexit, but also the US, and we're off to visit the US equivalent of our academy in May, but also global health challenges as well are very much within our reach. And finally, we encourage dialogue about medical research with the public, and it's so crucial that we keep the public on side if we wish to continue to do and be funded to do what we're committed to. So I mentioned our commitment to nurturing the next generation, and that is you. And one of the things that the Academy has been running for a number of years is a mentoring scheme, and I hope that many of you in the room this morning have already availed yourselves of mentorship. If you haven't, then please do, because all postdoctoral fellows in the UK can access the Academy's mentoring scheme, which is a one-to-one scheme where you identify somebody that you choose as a mentor, who's willing to devote some time to just meet with you periodically, not frequently, but periodically, to discuss your career advancement, your career choices, and so on. So we now have a total of 500 mentor-mentee partnerships that are active, and as I say, if you haven't explored that scheme, please do talk to Academy staff today to do so. Again, supporting careers, we have many funding schemes, including clinician scientist fellowships, starter grants for clinical lecturers, an equivalent scheme for basic scientists called Springboard, a scheme to develop women leaders called Sustain. Now, the other thing to mention by way of introduction is that the Academy is launching a program under this title, MedSciLife, and that is in recognition of the fact that work-life balance is immensely important And to have the most successful, enjoyable, and fulfilling and impactful career, then it's important that you get that work-life balance right. And what goes on outside of work is undoubtedly influential in what goes on inside your working life. And so the Academy is collecting stories, and some of those will be published in the issue of The Lancet that accompanies this meeting, collecting photographs of people at different stages in their careers. And there's a Twitter discussion going on at #MedSciLife, which you're very welcome to engage in. This is me in slightly less formal setting. This is with two of my children in Italy, where we have had the pleasure of restoring a ruin, which has been threatened by recent earthquakes, in fact, but it's still standing, I'm happy to say, and I escape there whenever I can, and indulge in sketching. Now, I don't think anybody's necessarily going to hang any of my sketches, but it's immensely therapeutic for me to spend 2 or 3 hours focused just on one thing, which I rarely do in my life. We're all dashing around trying to do 3 things at once or more. And finally, the reason the Academy is as successful as it is because it has a fantastic full-time staff photographed here, and many of them are with us today, and please do make a point of talking to them to find out more about what the Academy can do for you and what in the future you can do for the Academy.